and welcome to SureenaSpeaks, and in this video I'm going to be covering antibiotic counselling points. Now this might sound really sad, but this is an area which I really like covering and going over, and I think especially if you're working in a dispensary setting, it's a really easy topic which you can try and revise whilst you're at work. If you've seen any of my other videos, you know I'm a big advocate for actively revising whilst you're at work, and so this is one of those occasions where it's a really good way of doing that. So when you're presented with a prescription for an antibiotic, try and think yourself, okay, what counselling points are required for this particular medicine? And then when you're generating the prescription and the labels are being produced, you can then cross-reference and check actually what labels, what key counselling points are being produced, and ultimately what then do I need to let my patient know and what should I counsel them on. In general, with most antibiotics, they do have the cautionary and advisory label 9. So with all of the cautionary and advisory labels, they are in the BNF. I've actually got a copy in front of me right now. And label 9, just so I get the wording on point, I'm going to read it out. It is to space the doses evenly throughout the day, keep taking this medicine until the course is finished, unless you are told to stop. So pretty much all antibiotics have that label 9. So as we're going through this video, I'm actually going to be talking about counselling points in addition to this one. So we're going to park that one. Most likely it will be there for every single antibiotic. So I'm going to park that one and instead cover some key additional ones, as well as with certain medicines, the actual monitoring requirements that are needed as well, and just some additional counselling points and information too. So I do hope that you enjoy this video, and if you do, please make sure to give it a thumbs up, share, like, subscribe. Do also visit my Facebook, Instagram and Twitter. So let's start off with our penicillins. So penicillins, you've got, for example, amoxicillin, flucloxacillin, phenoxymethylpenicillin, sometimes referred to as penicillin V. Amoxicillin, aside from ensuring that you space the doses evenly throughout the day, etc., there isn't really any other key additional points that I want to mention with that one just yet. So instead, I will focus on flucloxacillin and phenoxymethylpenicillin. And with both of these, label 23 refers to both of them. And label 23 is to ensure that the patient takes the medicine on an empty stomach. What does an empty stomach mean? It means at least an hour before food or 2 hours after food. And it's important that you make that clarification to patients, because saying take it on an empty stomach, chances are they won't know what that means. So make sure you are clear in the counselling points and the directions that you do give them. In addition, with flucloxacillin, there is a risk of hepatic disorders. So in very rare cases, there is a risk of cholastic, jaundice and hepatitis, and it can even occur up to a couple of months after stopping treatment with flucloxacillin. So if you've had an administration for over 2 weeks or increase in age, these can all be risk factors, and it should be used in caution in patients with hepatic impairment. Another additional counselling point with any of the penicillins, so amoxicillin, making up a new one there, amoxicillin. So with amoxicillin, with phenoxymethylpenicillin and with flucloxacillin, you need to be aware of any hypersensitivity reactions, for example, and even allergic reactions as well, especially if someone's never had a penicillin before. If that does occur in a patient, then they should avoid any other product which contains penicillins. If, for example, something like coamoxiclav, which does contain amoxicillin within it, and also avoid the cephalosporins, that group as well of antibiotics, they should be avoided too. So it's really important to document if a patient does have a penicillin allergy, and any time that you do give out penicillin to a patient, make sure you do double check with them. Do they have any existing penicillin allergies? Have they taken penicillins before? Are they aware that they're allergic to penicillin? If they've not had it before, if they've not had it before, chances are they don't know if they have an allergy or not. So you might want to ensure that they know what to look out for. We're not trying to scare them, we're just trying to prepare them. So the next one we're going to focus on is metronidazole. Quite a nice and easy one. There's 2, I would say, real key counselling points with metronidazole. One is that it should be taken with or after food. The second is that alcohol should be avoided. Otherwise, it can cause disulfiram-like reactions. So symptoms of these could be, for example, flushing or palpitations, and actually alcohol should be avoided 48 hours after taking metronidazole as well. So food and alcohol, key ones to remember with metronidazole. So the next one that I'm going to talk about are tetracyclines. Confusingly, tetracyclines is the name of a group, but it is also the name of an individual medicine as well. So I'm referring to tetracyclines as the group. Now, with the tetracyclines, there are various counselling points with them. A key one is a differentiation between label 6, so the advisory and cautionary label 6, and the advisory and cautionary label 7. So label 6 says, do not take indigestion remedies or medicines containing iron or zinc 2 hours before or after you take this medicine. Label 7 says the exact same thing, but with the addition of milk. So do not take milk or indigestion remedies, etc., etc., etc. So some tetracyclines refer to the milk, don't take milk. Some of them don't refer to that milk statement. And there are some really easy acronyms that you can remember to help remind you which ones you should avoid in milk and which ones refer to that label 6 that doesn't mention milk. And they are DOT. So DOT refers to dimeclocycline, oxytetracycline, and tetracycline. Side note, some types of medicines probably don't pronounce them the right way, but I mean, does anybody really pronounce them the right way? So just bear with me. So dimeclocycline, oxytetracycline, tetracycline, those ones, milk should be avoided. So those ones refer to that label 7. Do not take it with milk. Whereas doxycycline, limacycline, aminocycline, those ones actually refer to label 6. So milk isn't mentioned within label 6. And an easy acronym to remember is does like milk. So doxycycline, limacycline, aminocycline, does like milk. Whereas our DOT, dimeclocycline, oxytetracycline, and tetracycline, nah, don't want to be taking that with milk. Essentially what happens is, if you imagine this is tetracycline, this is the calcium, which is in milk, the two are going to bind together. And what happens is that these go along in the body and they deposit in calcifying areas such as your teeth and your bones. So DOT, no milk. Also with DOT, the counselling point label 23 refers to them. So again, label 23 is that one about taking it on an empty stomach. So an hour before food or 2 hours after food. Another key counselling point, which refers to dimeclocycline and doxycycline, is to ensure that the skin is protected from the sun and UV radiation, which is label 11. Now, my mind works in mysterious ways of how I remember things. This might help you as well in how to remember this particular counselling point. It might not help you, but hopefully it will help you. And the way that I remember it is dimeclocycline, doxycycline, both begin with a D. You can get vitamin D from the sun. You see there's a little link there. Therefore, with dimeclocycline and doxycycline, we want to protect our skin from sunlight, from UV radiation. Like I said, that's how I remember it. Hopefully it will help you too. Another key point with tetracyclines is that most of them should be avoided in those that are under 12 years old because it can be associated with impaired bone growth and discoloration of teeth as well. The next medicine that I'm going to talk about is Nitrofurantoin. And this medicine is a good example of a medicine that is available in different forms, and actually depending on what form you're taking will depend on what counselling points are given. So with nitrofurantoin in general, it can discolour urine, but this is harmless and it can go like a yellow-brown colour. Regardless of what form, that counselling point exists pretty much for all forms. However, for the modified release preparation, additional counselling points are that it should be taken with or after food and should be swallowed whole. It shouldn't be chewed or crushed. And I guess there's logic in that, isn't there? It's modified release. We don't want to be chewing or crushing a modified release preparation. So actually, that's quite an easy one to try and remember. If it's a modified release preparation, chances are it's going to have that counselling point of don't crush or chew. Long-term therapy with nitrofurantoin, there's a few things that we should monitor. One of them being liver function and the other one being pulmonary symptoms, especially in the elderly. So the next one that we're going to talk about are the macrolides. So azithromycin, erythromycin, clarithromycin. So with azithromycin, that one refers, with azithromycin, we need to remember label 5. So label 5 is do not take indigestion remedies 2 hours before or after you take this medicine. And that actually refers to erythromycin gastro-resistant tablets as well. An additional one with azithromycin, with the capsule only, is that it should be taken on an empty stomach, so an hour before food or 2 hours after food. Another point with erythromycin gastro-resistant tablets is that it should be swallowed whole as well. And with clarithromycin, referring to the modified release preparation, like we said before, with modified release preparations, they should be swallowed whole, they shouldn't be crushed or chewed. As well as that, it should be taken with or after food. So that's for the clarithromycin modified release preparation. So the next one that we're going to talk about is trimethoprim. So with trimethoprim, especially long-term treatment, we want to make sure that we counsel our patients that they're able to recognise any signs or symptoms of blood dyscrasias, because that is a risk with long-term treatment with taking trimethoprim. So that could be, for example, a sore throat, a rash, bruising, bleeding, and if a patient does develop any of these, then they should seek medical attention, immediate medical attention, straight away if any of these symptoms occur. Other areas that we would need to monitor with trimethoprim is blood counts, especially in those with or at risk of folate deficiency. Also serum electrolytes in patients that are at risk. Renal function is another one, as well as the plasma trimethoprim concentration. Now we're going to talk about clindamycin. So clindamycin capsules, the advisory label with that is label 27, which is that it should be taken with a full glass of water. Another key point with clindamycin is that if a patient develops any severe, prolonged or bloody diarrhea, then the medicine should be discontinued and they should seek immediate medical attention. Reason being is that this could be a sign of antibiotic associated colitis, which can actually be fatal. So again, we don't want to scare our patients, but it is worth mentioning to them that if diarrhea does develop whilst they're taking clindamycin, then it should be discontinued and they should seek immediate medical attention. Now we're going to talk about quinolones. So for example, ciprofloxacin. So with ciprofloxacin, you can get it as a tablet, you can get it as oral suspension, and with both of these, the counselling points are label 7, so don't take with milk, indigestion remedies, or medicines containing iron or zinc 2 hours before or after you take this medicine. So it's the same as our DOT that we had in our tetracyclines. So if you wanted to group them all together, you could try and think of an acronym such as DOT-C or C-DOT. So that would refer to ciprofloxacin, dimeclocycline, oxytetracycline and tetracycline, because all of those refer to that label 7. As well as that, for ciprofloxacin, label 25 also refers to it, and that is to swallow the medicine whole, to not crush or chew it. There's two other key points when it comes to quinolones. One being convulsions, the other being tendon damage. So with convulsions, quinolones may induce convulsions in patients with or without a history of convulsions, and even in those taking NSAIDs at the same time, it may induce this. So if you have a prescription for ciprofloxacin, then you might want to just make sure that the patient, are they taking NSAIDs for any particular reason? If they don't take NSAIDs, then maybe advise them to avoid taking an NSAID whilst they're on the ciprofloxacin. Do they have a history of epilepsy, for example? All of these are really important questions before you dispense and give out that ciprofloxacin to a patient. And the other one that I mentioned was tendon damage, which is rare, but it has been reported, and it may occur within 48 hours of starting treatment. There have been also reports of it developing months after stopping a quinolone as well. Another key point with quinolones is to avoid excessive exposure to sunlight and UV radiation during treatment and for 48 hours after stopping treatment as well. So another one that I'm going to talk about is gentamicin, which is an aminoglycoside. And with this one, there is a risk of ototoxicity and nephrotoxicity. Therefore, both auditory and vestibular function should be monitored during treatment with gentamicin. So the next area that I'm going to focus on now is actually on TB and the medicines that are used in TB and in its treatment. Again, it's one of those ones that once you've got it in your head, it can be quite an easy one to remember. So with TB, treatment is split into two phases. You have the initial phase and you have the continuation phase. With the initial phase, you take 4 medicines for 2 months. With the continuation phase, you take 2 medicines for 4 months, and those with active TB without any CNS involvement. What are those 4 medicines? They are rifampicin, isoniazid, pyrazinamide, and ethambutol. How do you remember that? Easy, the acronym RIPE. So RIPE, you take RIPE so those are our 4 medicines, that will be for 2 months. And then for an additional 4 months, so for that continuation phase, we're just going to take rifampicin and isoniazid. So RIPE to start with, and then RI to continue with. RIPE is available as a tablet or 4 medicines neatly mushed into a tablet. The counselling point for that medicine is to take it 30 to 60 minutes before food. Now let's look at each of those 4 medicines in a bit more detail and some of the counselling points with those individual medicines. So if we start off actually with rifampicin, isoniazid and pyrazinamide, with all 3 of these you would need to monitor renal function before treatment, as well as monitoring hepatic function, because there is a risk of liver toxicity with these 3. So with our patients, we want them to recognise any signs or symptoms of liver disorder. So this could be nausea and vomiting, malaise, jaundice, so yellowing of the skin, for example. As well as that, with rifampicin, we also need to monitor blood counts, especially that are those that are on prolonged therapy. And another key counselling point with rifampicin is that it can discolour soft contact lenses an orange-red colour. I'm pointing at my own eye because I'm currently wearing soft contact lenses. So yeah, it can make the fluid go an orangey red colour, and then that can stain the contact lenses. So if you have someone who's on rifampicin and they are a contact lens wearer, that's a really key counselling point to give them. Moving on to isoniazid. So with isoniazid, pyridoxine might be given prophylactically, and it should be given prophylactically in all patients who are taking isoniazid to try and prevent the risk of peripheral neuropathy, which can happen with isoniazid. Those that are at particular risk of peripheral neuropathy are, for example, diabetic patients, pregnant patients, those that have HIV infection, those that have alcohol dependence, for example. So as well as taking those 4 medicines, actually with the isoniazid, there's a sneaky 5th one in the form of pyridoxine, which should be given as well. There isn't really anything in addition that I want to mention with pyrazinamide. Just remember that with that RIP, quite morbid that, but with those 3, you would need to monitor hepatic and renal function for treatment, and just remember that risk of liver toxicity as well. And the 4th one we're going to talk about is ethambutol. So our ethambutol, again, renal function needs to be monitored before treatment. And another key counselling point with ethambutol is to do with vision. So before treatment is started, vision needs to be tested using a Snellen chart. Snellen charts are one of those charts that are used when you go to the opticians and you have to go like this and you have to try and read what's on that chart, what letter it is that they point to. I'm awful at them. But it is really important to test vision because there is a risk of ocular toxicity with ethambutol. And so if a patient says that they've developed any kind of deterioration in their vision, then they need to seek immediate medical advice. Easy way to remember ethambutol and vision is the word eyes. E for eyes, E for ethambutol. Nice easy way to remember it. So I know that there has been a lot of information that has been condensed into this BNF bite size, but I do hope that there is enough there to get your teeth into some of those key counselling points, some of those key monitoring parameters as well. And And as I suggested at the beginning of this video, do make sure that when you are if you are in a dispensary and you are presented with a prescription, try and test yourself with what counselling points you should give, and bear in mind different formulations of the same medicine may have different counselling points as well. So please show your love for this video. I do really appreciate it. Hit that subscribe button too, and until next time, good luck with your revision and happy revisings!